Moving on to the modalities, which I love. They're near and dear to my heart. We're going to cover in regards to their specificity for neuropathic pain. So for those who are not familiar with the loop, there is a whole webinar devoted to that. But the CC loop delivers microcurrents to tissue using a pulsed electromagnetic field, and they enhance the production of nitric oxide. This modulates the body's response to injury and trauma. There is actually a small body of literature on PEMF improving diabetic neuropathy, improving neuronal survival in conditions of hypoxia due to reduced blood flow in diabetics, improving nerve growth and motor recovery in spine injury, and some really interesting pilot studies in mice and rats, as seen on this graph on the right, showing that PEMF strongly decreases allodynia in a standard model using a calibrated microfilament to assess. In this blinded study, these rats underwent chronic constriction of the sciatic nerve and had developed allodynia by 3 and still at 10 days later. They were reassessed at day 45 and then treated with the CC loop. And those rats treated with the PEMF showed a decrease in allodynia. So this is one of the things that I'm always going to use because I think it has great promise. Next, the underwater treadmill, and January's webinar for me is going to be on hydrotherapy. What I like to use in cases of neurological deficits, et cetera, the belt that goes around and around in the bottom provides the neurosensory feedback to encourage locomotion and proprioception. You see that dog also has a piece of vet wrap on its foot, which is also helping. The warm water will support the weak patients, so those peripheral neuropathy dogs that are kind of dragging their toes around, they can get the buoyancy and support, and the warm water will increase circulation, strength, and endurance. So I do like this modality. And most of the neurologically impaired animals that cannot walk on land will walk in water much more frequently than on land. So I like that. Laser. There's more widespread adoption that laser therapy decreases pain and inflammation by enhancing nitric oxide, as well as blocking the depolarization of C-fiber afferent nerves. So they just dampen that response. Massage. Besides what we already know about the feel-good benefits of massage, it also influences the sensory and autonomic nervous system, including reflexes that decrease blood pressure, they slow down breathing, and improve digestion. Levels of cortisol and epinephrine decrease as serotonin increases. Patients that receive massage also consistently report feeling less pain and request less medication analgesia intervention. The body and the mind are both linked to the skin via the nervous system, and different types of touch will elicit different types of mental responses. Psychologically, massage decreases stress and anxiety, produces relaxation, and improves emotional well-being. Dogs and cats lick and rub themselves and their young in response to injury and pain and emotion, so it's not far-fetched to assume that they too can feel the same psychological effects of massage that we do. So here's really one of the more interesting. There's been a ton of research done on this, but still some adoption is hard by veterinarians, and they want, big, full randomized clinical trials. But there's some interesting work that I discovered in putting this together. So the stimulation of local nerve endings, when you insert an acupuncture needle, it causes a local axon reflex. That leads to blood vessel dilation and mast cell activation. And in response, there's a stimulation of nerve endings in that area, and then a variety of neuropeptides are released, and combined with the changes in blood flow, it contributes to local pain relief. Okay, so that's cool. I can understand how it works right there. There's often a sense of pain relief at a site distant from where the acupuncture needle was inserted, and these are actually likely due to the modulation of neurotransmitters and neuromodulatory substances. These substances are key players in the pain pathways, and alteration in their concentrations offers an explanation for the analgesic mechanisms of acupuncture. Some of the most groundbreaking early research in this area includes a study where the cerebrospinal fluid from rabbits treated with acupuncture was given to recipient rabbits that received no treatment. The rabbits that received the CSF showed an increase in pain threshold during subsequent painful procedures. Acupuncture also has an analgesic effect via induction of the endogenous descending pain control pathways that modulate nociceptive signals at the level of the brain and the spinal cord, again, enhancing some of our favorites, serotonin and norepinephrine. With acupuncture, the spinal and brain concentrations of both are increased in rat models. In humans with fibromyalgia, acupuncture treatment induced an increase in serotonin levels in the plasma, as well as pain relief, and a decrease in specific sensitive spots. There's also a possible synergistic effect of amitriptyline and a different NMDA receptor antagonist with electroacupuncture for pain and reduction of hyperalgesia in rats. It's an ongoing area of research, but it really offers promise for our understanding of acupuncture mechanisms and integrative modalities for chronic pain conditions. So we're going to go to a case, and I wish, because something that could actually tie all of us together, a lick granuloma is a perfect example of a case that could use behavioral therapy, rehabilitation, etc. But I don't have one of those, but I have something that's pretty interesting. This is Madison, and she's adorable. And she's an 8-year-old female spayed King Charles Spaniel with caudal occipital malformation. She's had phantom scratching fits since she was a puppy, with about 4 to 6 fits per day. Of course, as we all know, a dog like this would have to be owned by a veterinarian or a vet tech, and this is owned by a veterinarian who's doing an integrative medicine fellowship at a university. So she's been paying close attention to her dog. And we're going to see Madison, and the owner can actually induce these scratching fits. She's adorable, and she's just going to kind of get her going there, and then she's going to start thump, 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 thump. There we go. Poor girl. And there's a much more extensive case story about Madison in one of the other webinars we've done. Diagnosis of Chiari-like malformation with syringohydromyelia is based on a combination of characteristic clinical signs, as the other doctors have talked about, sort of breed-specific, and supportive MRI findings. The pathogenesis of the syringohydromyelia is uncertain, but is thought to be related to abnormalities in CSF flow through the foramen. Normally, the pulse pressure of the CSF flow is equal to the pressure within the spinal cord, thereby a homeostatic environment. In Chiari malformation, in people, obstruction of the subarachnoid space by the displaced cerebellum is thought to result in a mismatch between the pulse pressure of the CSF and the pressure within the spinal cord. So this transient increase in pressure allows distension of the parenchyma and tissue injury, and then causes extravasation of the plasma into and forming syrinx. Damage to the nerve cells in the dorsal columns resulting from syrinx development supports the concept that the pain demonstrated by dogs with COMS is due to changes in the neural processing of pain at the level. Pain arises from a decrease in the threshold for activation, which we've talked about, and increased responsiveness to synaptic inputs from repetitive C fiber discharges. Increased release of glutamate and substance P occurs, which alters neuron excitability for hours. In addition, loss of inhibitory neurotransmitters such as GABA and glycine results in painful reaction to innocuous stimuli. So obsessive scratching at the shoulders without contact is almost pathognomonic for dogs with Chiari-like malformation and syringohydromyelia. Other common signs include increased sensitivity around the head and neck, inability to tolerate a collar or grooming, nonspecific pain, and unfortunately sometimes progressive tetraparesis and tetraplegia. Medical therapy for COMS generally falls into 3 categories: analgesics, which we talked about, to relieve the dysesthesia and paresthesia, drugs that decrease CSF production, and sometimes steroid therapy. So Madison went on gabapentin and omeprazole to decrease the CSF production, and she initially improved, but kept on having to increase her gabapentin dose. Unfortunately, all the great things that we've talked about tonight, actually she did not tolerate. She tried acupuncture, she hated the needles, she tried laser therapy, massage, and chiro, and all of these made her worse. So she wrote to the Assisi company and asked, hey, what do you think about this? And she ended up trying a loop, and she looks pretty comfortable there. The owner said that was such a blessing because through all the other modalities, the dog did not tolerate. And within the first few days, Madison was treated 4 times a day, and immediately, within 24 hours, her pruritic fits substantially decreased to 0 to 2 per day. That's pretty cool. And she couldn't even get her to induce those scratching fits.
So, yeah, just to finish up, supplements are used for a variety of reasons, and we don't, unfortunately, have a lot of evidence to use supplements and nutritional modalities for neuropathic pain or neuropathies in general. We have level D evidence because there are a number of specialists, and I mean high-level specialists in their field of neurology and neuromuscular diseases that do recommend these supplements, so they are worth mentioning. Carnitine certainly has the potential to reduce the amount of muscle wasting, but it doesn't necessarily make sense to use carnitine unless you're also using that in a program with physical therapy to actually improve that. So if the patient's just lying around, the carnitine probably isn't going to do very much. Coenzyme Q is a free radical scavenger. And so, that has some first principles evidence for it that it might actually be anti-inflammatory and actually reduce some of the chronic damage that's occurring. And certainly we know that the B vitamins are all highly important for our nerves to function properly. And so these supplements are recommended in the literature, and certainly they would do no harm that I could see, and they might actually provide some benefits. But it'd be nice to see some actual studies where these were used in actual either case reports or, of course, randomized clinical trials are always ideal.
Great. Thank you. At this juncture, we're going to entertain some questions from the audience. And first, I want to thank all of our panelists this evening for some great information and bringing your perspectives to this topic. The first questions that we have from our audience relates to the use of the loop. So, Dr. Chiaramonte, I'm going to unmute your microphone. Question is, if you were to use the loop for treating neuropathic pain, how long does one use it? How many times per day or how many times per week? And are the effects additive as the use of lasers are?
Very good question. So it's a 15-minute treatment period, and what we suggested for Madison and probably some dogs that have been trying some other therapies at this point is to try it 4 times a day and see if that makes any difference. And, it'd be great if everybody felt better within a day. Not all do. I've used the loop. My first introduction was in osteoarthritis cases, and then I got into more of the neurological cases. And I will tell you, although we like to say that the loop doesn't have any side effects, it is the neuro cases that sometimes, it's not necessarily a side effect, but I think that a lot of these dogs that sometimes have had no feeling for a long time will start to get, with the increased blood flow, that pins and needles effect. And since they can't communicate that it's that and not pain, which that's certainly uncomfortable, but that's actually a good thing, blood flowing, going back to those areas, that some of those patients react. So if they do that, I have had success, I'd say 100% of the time, actually just backing the treatment time down to, let's say, 5 minutes, and doing that for a couple of treatments and then upping up the time each time. Yes, it is additive, and I try to use as many modalities as I can, but the blessing of the loop is that they can use it at home. So you do the laser in office or at your house call. The treadmill obviously is not an at-home treatment, but then send them home with that loop and have them use it.
Thank you, Dr. Chiaramonte. Dr. Christensen, I think you had some afterthoughts or other thoughts to contribute here this evening.
Yes, thank you, Dr. Berger. I did want to say, following up on Dr. Chiaramonte's stuff, we work pretty closely with different integrative veterinarians and rehab veterinarians, and part of our job, aside from the stuff that we focused on tonight from the behavioral standpoint, is to treat underlying anxiety, not just with treating the pain and with additional anxiolytic medications of all sorts of varieties, but from the environmental changes that we can implement. Many animals have fears, phobias, even panic attacks, and triggers for growling, snarling, snapping, or biting that family members have tolerated or managed for a long time, but they may not be managing them very well. And when we're in a situation like this, it is really important that we help teach that animal and that family how to interact with each other in the most, I guess I could say, peaceful way possible. Not to say that you can't have fun, but we want to make sure that the owner's interaction patterns with the animal aren't accidentally increasing discomfort, either emotional or physical, like Dr. Chiaramonte was talking about with her Cavalier King Charles. We have a lot of those dogs come into us too for these clinical signs, and while we may be managing them with either physical therapy and their neurologist or on our own because they won't allow referral, we not only focus on making sure that we're dealing with the pain, but also what can we do to keep this animal's mind peaceful? What can we do to help this animal deal with life and cope better, more effectively? How can we make sure that we're meeting this animal's emotional and evolutionary needs? Because often those very basic needs for each species are absolutely categorically not being met. And while many animals will sort of get by and even thrive despite the fact that we're missing all of these different things that we should be doing for them to help them be healthy and experiencing their normal behaviors, unfortunately, some animals don't tolerate that well. They just aren't able to cope like that unless the family has some hand-holding and knows how to refocus behaviors, enrich the animal's life, make sure that the training is positive reinforcement-based, that we've got the punishers out, because those increase anxiety, conflict, and fear and aggression in many patients. And whenever that's happening, we have a risk of increasing pain. When we have our patients mentally healthy, we have a much better chance that they're not going to be experiencing pain at the same level of intensity, or that they're going to be able to cope better with it. So I just wanted to throw that out there. We've got lots of ways to do that. Veterinary behavior